There are people graduating right now from nursing school being told that their jobs are AI proof. It's not. And the data doesn't lie. Let's walk through what a nurse actually did 10 or 15 years ago. They did patient intake and initial assessment. This was full human judgment. They did charting and documentation, which took hours of their shift. They did triage. They could read symptoms and prioritize care. They coordinated with physicians. They communicated diagnosis. They monitored vitals, flagging any changes. They handled medication management and administration. They also took care of patient education and discharges. That was the full scope. That's what justified the degree and what justified the pay and gave them a professional identity. Now, let's walk through what's happened to each of these functions. Here's what's already been automated. Charting. Voice-enabled intelligent tools are already in place. Nurses speak and AI documents in real time. Documentation time has been cut by 30 to 50% in major hospital systems. The chart no longer needs a nurse to write it. Triage. Virtual triage assessments handle patient questions, flagging issues, route cases before a human nurse ever sees that patient. And these are also already in deployment at major hospital systems. Predictive analysis. AI is now surfacing early warnings of sepsis, potential falls, and patient deterioration. AI is catching things that a nurse in her 12th hour of a 14-hour shift misses. This is not hypothetical. This is actually happening. X-rays, CT scans, and ultrasound. These are all read by AI now with accuracy rates that match or even exceed the human radiologist. The technician who runs these machines is also at risk. The physician who reads the scan, also at risk. Medication management. There are automated dispensing systems. There have been for years at many hospitals. AI is now optimizing the dose and is now flagging interactions faster than any pharmacist. Another thing to note is who owns the majority of the hospitals in the US are now owned by private equity or large corporate health system. These are not mission-driven organizations. These are margin-driven. Every hour of nursing that can be replaced by software is a line item that disappears. The incentive to automate isn't compassion, it's earnings per share. Hospitals are not asking, will this be better for patients? They're asking, what does this do to reduce our cost per patient per day? If the answer is AI cuts it significantly, the decision is made. Let's talk about burnout for a second. The reality of burnout for nurses is real. 58% of nurses report feeling burned out most days. 14-hour shifts are not the exception. They are the standard. A nurse who is on her 12th hour, who has skipped both of her meal breaks, is not in her peak clinical judgment. And she knows that. AI doesn't get tired. It also doesn't get cynical. It doesn't miss cues just because it checked out an hour ago. This isn't an indictment of nurses, mind you. It's an indictment of the system that burned them out and is now replacing them with technology. Hospitals don't care why the cue was missed. It cares that AI doesn't miss it. So what's actually left? Well, let's walk through what's been separated out. Phlebotomy. Drawing blood is now a phlebotomist's job. It's not a nurse's primary function. X-rays, CT scans, ultrasounds. Again, technicians run those machines, not nurses. For diagnoses, physicians do that, and AI is increasingly helping them do that. Documentation, automated. Triage, automated. And monitoring is increasingly handled from a central station where AI is flagging changes. So what's left? The physical tasks, the ones that require a body in the room. Changing bed fans, turning patients over to prevent bed sores, wound care, cleaning human waste off sheets and body parts, the IV in the arm, a hand on the shoulder. That's not nothing. They're real and they're necessary. But that's not the profession that was sold to someone at $120,000 to enter into it. So actually, let's break down some of the math. A BSN degree at a public university in state can cost somewhere between $108,000 and $176,000 total. Private schools can run up to $300,000. A starting salary for a new RN, this is outside of California, is somewhere between $65,000 and $74,000. All right, so let's talk about take home. Take home after taxes is about $4,100 per month. That's what we have to work with. Dollar loan, student loan repayment on $120,000 at 6.5% is $1,350 per month. Rent or mortgage in an average American-sized city is somewhere between $1,500 and $2,000. Car payment, insurance, utilities, food, there's another $1,300 a month. So your total monthly obligations are somewhere between $4,150 and $4,650. Your monthly take home is $4,100. The math doesn't work. It didn't before AI started reducing the scope of the role, and it doesn't work now. So what's the real question? The people I see going back for nursing now are saying they do it because it is an AI-proof profession. That belief is being marketed to them by universities that need tuition and healthcare systems that need bodies. The honest question, and one that no one is asking on their behalf, is in 10 years, what does the nursing role actually look like? Is the debt that I'm about to enter into worth what the role will pay and what it will require of me? That's not a cynical question. That's a responsible one. I'm not telling you nursing is gone. I'm telling you the version of nursing that justified the degree, the debt, and gave you the identity has already been restructured. The people marketing the degree to you have a financial incentive not to tell you that. The rules have changed in nursing. They've changed in every industry. The professionals who come out ahead are the ones who stop running from that and start building something that belongs to them, regardless of what the system does next. If you want to know where you stand, check out AIBurnCenter.com/quiz. You'll see an assessment. It'll give you a clear picture of where you are in the AI disruption and what you can do next. My name is Rebecca. I'm here with the AI Burn Center, and we're a new channel, so we would love your like and follow. See you next time.